starts with the basics, a physical examination. The doctor will look at and feel your neck, palpate the thyroid, checking its size and shape, whether it feels smooth or lumpy, firm or soft.
Just getting the feel for it first. Then what?
Then blood tests. These are crucial. They'll run thyroid function tests, TSH, T3, and T4 to see how the gland is actually performing. Is it normal, overactive, underactive?
And those antibody tests.
Yes. Also key blood tests. Testing for anti-TPO antibodies helps diagnose Hashimoto's, and testing for TSH receptor antibodies points towards Graves' disease. So these help pinpoint why the function might be off, especially if it's autoimmune.
Okay, blood tests tell you function and potential autoimmune causes. What about actually seeing the goiter in detail?
That's where imaging comes in. The main tool mentioned is ultrasound. It's great because it uses sound waves, no radiation, and gives really clear pictures of the thyroid size, structure, and any nodules. It helps assess nodule characteristics. Are they solid, fluid-filled cysts? Do they have suspicious features?
Ultrasound first, and then there's that radioactive iodine uptake scan, the RAIU.
Right, the RAIU scan. This one looks more at function within the gland structure.
And this is where hot and cold nodules come in. Can you explain that again? Why is that important?
Sure. So you swallow a tiny, safe amount of radioactive iodine. Active thyroid tissue naturally takes up iodine to make hormones. A hot nodule on the scan is one that's soaking up more iodine than the surrounding tissue. It's overactive, usually making hormone itself. And the good news is, these are almost always benign.
Okay, hot means active, likely benign. What about cold?
A cold nodule takes up less iodine, or none at all, compared to the rest of the gland. It's not participating in hormone production in the same way. Now, most cold nodules are also benign, but they have a slightly higher risk of being malignant compared to hot nodules. So seeing a cold nodule often leads to further investigation.
Got it. That distinction is really helpful for assessing risk. And if there's a suspicious nodule, maybe a cold one on the scan or one that looks worrying on ultrasound.
Then the next step, according to the notes, is often a fine needle aspiration biopsy, or FNA. They use a very thin needle, guided by ultrasound usually, to take a small sample of cells directly from the nodule.
To check for cancer cells.
Exactly. Those cells are looked at under a microscope. It's the most definitive way to determine if a suspicious nodule is malignant or benign. So you can